There is a crisis in our country. Each year, thousands of people die on organ transplant waiting lists, and for many, the life-saving organ will never come. Currently, we depend on the goodwill of anonymous donor families to say yes to organ donation. Sally Sattel, a doctor and kidney transplant recipient, says, "Altruism is insufficient to meet the pressing need for organs. Until we stop thinking of transplantable organs as gifts, we are never going to have enough." If the government provides proper compensation for those thoughtful enough to donate their organs, the outcomes will be an increase in organ donation numbers and more patients getting a chance to live longer and healthier lives with a much-needed new organ. Before we talk about the argument for payment, a brief summary of organ donation in the U.S. is worthwhile. A significant issue in the world of organ donation is the number of patients on a waiting list. Currently, more than 120,000 men, women, and children are awaiting organ transplants in the United States. This reflects the pressing need for organ donation. Related to the dire need for organs is the number of people who die waiting for an organ donation each year. According to a recent study done by the Organ Procurement and Transplantation Network, more than 4,500 people in the U.S. have died waiting for kidneys. This is of the 80,000 total patients, and that's more than 5%. Our nation's priority should be that no patient dies due to the unavailability of a needed organ. Today, while 16 people are dying a day waiting for an organ to be donated, families still refuse to donate the organs of a deceased family member nearly 50% of the time. The most compelling argument for paying donors and their families is simply to increase the number of donated organs. According to the University of Calgary, in a study surveying those with and without the need of an organ transplant, 70% of respondents saw financial incentives as a turning point incentive for the families of deceased donors. If financial incentives were seen as a turning point by a majority of people, then why would we not want to provide them? Looking at two separate censuses conducted, every single state in the U.S. that offers tax breaks for the courageous citizens who donate an organ during their life or after death has a higher organ donation rate. As the success of these state-offered tax breaks demonstrates, providing proper compensation for organ donation increases organ donation rates. Finally, in a survey done by Dr. Braden Mans, a clinical professor in nephrology, half of people who said that they wouldn't be likely to donate an organ changed their minds if the deal included a $10,000 payment. This investment would put government funding to good use because the number of organ donors would increase and the lives would be saved. While $10,000 may seem like a significant investment by the government just to finance one organ donation, it is actually less than the government typically spends on health care for a patient absent organ donation, and the patient's quality of life post-donation is improved. According to Dr. Mans, encouraging organ donation through financial incentives would actually reduce healthcare costs. While some may consider payment to organ donors as excessive and unnecessary, providing such compensation would actually decrease government spending on other life-saving medical procedures. In regard to federal healthcare spending, MSNBC.com's senior health editor Jonelle Alexia states, paying living kidney or liver donors $11,000 to $15,000 apiece would save the government roughly $340 per patient, as compared with the current cost of dialysis. Dialysis is a procedure used to extend the life of patients with kidney failure. These savings are made up of the approximately 120,000 people in need of a transplant. Alexia asserts if organ donations rose by 10 to 20%, the cost savings would then skyrocket up to $1,600 to $4,000 per patient because of the exponential growth of these savings. Alexia's research shows that paying donors actually pays off, and it corresponds directly with the research done at the American Journal of the American Society of Nephrology, which found out that because most patients wait 2 to 3 years for a kidney, the cost of dialysis during that wait is almost always higher than $10,000. If transplantable kidneys were made available on a timely basis to the patients in need, the cost of dialysis could be minimized or even eliminated. Some may say that while promoting organ donation makes economic sense, paying for organs is unethical. Those against paying for organs often argue that selling the human body is unethical. However, in the United States, selling certain body parts, including plasma, hair, sperm, and even human eggs, is completely legal. This information, however, is common knowledge. Yet some argue that donating things like hair and blood are low-risk procedures, so it is morally okay to pay them. However, oftentimes women who have an unwanted pregnancy will offer their baby to couples who may not be able to reproduce. According to the NICHD, in an article called "What Health Problems Can Develop During Pregnancy," there are many risks for pregnant women, including high blood pressure, heart disease, diabetes, autoimmune disorders, and many other possibly fatal circumstances. This means that women who sell their fetuses are at the same risk as someone who sells one of their vital organs, such as a kidney or a liver. If it is legal to pay for the donations of blood, bone marrow, and hair, all of which are important parts of the human body, then why is paying for a kidney not allowed? These two facts simply contradict each other. Another example of this is when participants often receive money to be part of a clinical trial that may involve health risks and even long-term side effects. Some of these clinical trials include procedures such as testing medicine for effectiveness and side effects. Over the years, nearly 2,100 clinical trials have resulted in human deaths. Providing organ donors with the cash to repay them for their courageous actions is consistent with the practice already in place today of paying individuals to take medical risks for the benefit of others through participation in clinical trials. A problem surrounding organ donation is the existence of an illegal black market for kidneys and other organs. If the United States put an organ donor financial incentive program into action, it would eliminate this unsafe and unlawful market. With respect to unregulated organ donation, Dr. Rebecca Skloot of Proto Magazine has written, "It is not known who, if anyone, reviews these black market donors' medical conditions to make sure that they won't be harmed by the loss of an organ. The organs may be inadequately screened for infectious diseases or cancer. They may be poorly matched to the recipients, and they may be handled by unregulated or even inferior surgeons." As reflected in Dr. Skloot's research, organ transactions on the black market are dangerous because the organ donor is unknown to the recipient, and the organ itself could be carrying disease. By eliminating this unlawful market, paying Americans to donate in the U.S., the surgery and conditions of all transactions would be safer and allow for better health of the donor and the recipient. It must be very clear now that providing any sort of financial compensation to the inspiring few who are brave enough to donate is beneficial. Not only would more organs be donated, but also more lives saved. This plan would completely knock down the black market and save the United States government money. Imagine two parents whose son is in desperate need of a kidney. The waiting list he is on is just too long, but the United States government begins to pay those to donate, and the list shrinks. Soon enough, that boy is healthy and alive, with a perfect kidney inside of him, thanks to the government for paying organ donors what they deserve. Thank you.